to My Adrenal Life with Kristen. Today I'm here with my friend Amy, who's going to talk to us about peptides. Amy, I know you and I have talked about peptides a lot. Do you mind just to kind of introduce yourself and tell everyone a little bit about your background?
Of course. So I'm Amy. I'm a physician assistant. I've been a physician assistant for almost 10 years now. My original background was in neurosurgery for brain and spine. Approximately about 7 years ago, I ventured off into the aesthetics and wellness space. Ended up discovering, when people look better or want to feel better, and really diving into the peptides. I always say, I'm always learning, and I feel like so much of that knowledge on peptides is really evolving. So if I don't know the answer, I'll get you the answer. But there's a lot. It's been really interesting in healing aspects of things.
Yeah. And total transparency, Amy is my esthetician. She tries to help keep me looking young. I see her frequently. I see Amy once a month, and she does a fantastic job for me. But her and I have had a lot of dialogue over the years, and we've talked about a lot of things. And really, this is where my journey started with peptides. Amy and I had talked about peptides. We talked about not just my adrenal insufficiency, but also my other comorbidities. And she helped guide me to what would be healthy for me and maybe what would not, and where I would need to have some caution and pause too. So as you all know, I've done the BPC 157. I have another video on that. So I talked about the differences that I saw there, and I'm continuing on that journey, and I'm enjoying that journey right now. But Amy, do you mind to share a little bit about what you've learned, and especially when it comes to the adrenal insufficiency side, because I think that's what this group wants to hear most, is like, what's dangerous for us, what's acceptable, like what do we need to think about? All the same questions probably that I had.
And I think, first and foremost, with adrenal insufficiency, not everybody is the same. The primary, secondary, what is going on metabolically in the body is different for probably every member in this group. And so in getting down to the why, the what's causing it, and then that better helps. And what a peptide is, people keep using right now, it's the trendy word peptide. All a peptide is a organic molecule that the body produces, usually naturally or in some form or fashion, that then is given to support that body's process for whatever it needs to do. And so in looking at the cause of the adrenal insufficiency, that better helps to guide where does the body need support. Now, of course, one of the positive things about peptides is because I just talked about they're organic. It's not it's not a chemical or affecting a process. A lot of times in medicine, what we do to treat things is to stop something naturally from happening. What peptides do is support that from happening. Now, you want to make sure that you definitely, for any type of peptide, get them from a verified source, because right now, because it is a trend, like with anything else, people are trying to make money off of them. So you really want to know where it's coming from. So that's my number one advice for anyone taking a peptide. You should know where it's coming from. Even, as a doing everything by the book wellness place, we have vendors who come in and say, well, just trust us, trust where it's coming from. And you don't, this is your health, and you all are the I've been so inspired because I've been in the group, but you all are your biggest advocate, and that's something. You don't just trust someone. They should be able to tell you, oh, it's been produced here, these are the specifications. Our products are constantly always meeting quality tests, purity tests, all of that. So that's number one, no matter what peptide. And then secondary, looking at, we talked about comorbidities, so looking at everything else going on metabolically, because your metabolism is a measure of all of these functions. And with adrenal insufficiency, we know, the end result, again, a lot of times, is that the adrenal glands are not responding and producing. The gut-brain adrenal connection is disrupted in some form of fashion. So how can we best support that? And in a lot of cases for adrenal insufficiency, that is more secondary. Some of that comes from healing the gut or immunomodulation or however that works. And so we can talk about a little bit more about those specific ones.
Awesome.
But, and I think a lot of things about peptides is they're supportive. They're not kind of, again, working against your body. They're working with your body. Mm-hmm. And in finding, okay, where does the body need the most support?
Yeah.
So.
and my experience has been fantastic with it. I was doing the daily injections, and I got it wrong the first time that I posted it. I said 30 milligrams. It's not 30 milligrams. And Amy quickly contacted me and said, you're not on 30 milligrams. You're on 300 micrograms.
Yes.
So that's where her specialty comes in.
Yes.
And so thank you for helping me with that. But 300 micrograms daily, which is an upper level dose, right? Because we were really trying to...
anywhere really from, and it depends also on the potency and purity, but anywhere from 250, I've seen even 100 sometimes, up to 600. So it just really depends, and a lot of times they're cycled. So in particular BPC, what it is a gastric related peptide, and it does a couple of different things. It works to promote, what's really interesting is it works to promote selective angiogenesis. So angiogenesis where we want it, and angiogenesis not where we don't want it. So we obviously, if there's anything bad or mal going on in the body, we don't want that to promote. Right. We want all of the good things, so tissue healing, injury healing, gut repair, decrease in inflammation, because by promoting the good, it actually decreases the cytokine production or our inflammatory markers to really help with recovery, pain. And they've actually looked on colonoscopies, going again, I'm a believer in the gut-brain connection somewhat, and they've looked at colonoscopy and the camera tissue there, and people who are on BPC actually have repaired desmosomes. So, and some of the things, and especially with, when we're talking about gut-brain adrenal connection, there's a lot, and even the thyroid, because I in reading about the thyroid prevalence with adrenal things too. Yeah. And, if you can heal the inflammation, repair the tissues, then you're going to have less pain. So that's another thing, as reducing from inflammation, also helping with pain relief. I've seen this for plantar fasciitis. I've seen this for pain. It actually, because of the angiogenesis, can actually help with blood pressure regulation too, which is really interesting. Okay. Generally regarded as safe for all populations. Biggest risk is injection site, usually. And if you have any active cancer treatment, because again, the angiogenesis is selective, but we're promoting tissue and tissue regeneration. So actively, you probably wouldn't want to give it to someone who has cancer, just because you don't, like it is selective, like I said, but it's never been tested on people with cancer, active cancer, because of that reason. Because who's going to push something that's going to promote that? So it's not studied. It's actually probably safe, because we know through the markers that it is selective, but that's one of the things that we know. Correct. So that's really the only exclusion there. Does it affect cortisol? Not directly. The goal would be to reduce inflammation so that the pathways of between the brain, the adrenal, that reset would be functioning more, I guess you would say, like more normally. And so better sleep, less pain, which then indirectly would support the adrenal glands, but does not do anything to directly affect cortisol levels, which is good and bad, because then you're not having that risk, is this going to make me drop or cause a spike or drop in that sense, but more so support the inflammation, angiogenesis, and then as well as the inflammatory kind of pain part of things. Awesome. It's great for pain. I put my dad on this for plantar fasciitis, and it's amazing. Yeah. So
it's been amazing for my pain. I was having really chronic, and I still have some pain, but I was having really chronic SI joint issues, and after the hip replacement, it really fired everything around my lower back and into my hips, and I'm currently having some healing issues a little bit with my hip replacement. And it was funny, because the first couple of days that I was taking it, I started to feel a little bit better, but it was kind of like, is this like the placebo effect?
Right. Is this real?
Yeah, is this real? Maybe exactly. I'm just feeling better in general. I was kind of questioning it at first, and then it got better and better and better. And then about week 3, I kind of plateaued. But I feel like I feel like that's what it's done, though, is the inflammation. I can actually lift my leg on my surgery side a little bit higher right now than I could before I started. And I think that's because it lessened the inflammation and the pain.
Mm-hmm.
And so with that, I'm able to kind of do more to kind of heal and move forward. So I'm really excited to see where this journey takes me. What are some other peptides that people with adrenal insufficiency or other chronic illnesses might be interested in?
So right now, and you may have seen in the news, there is 11 peptides that just went to be generally regarded as safe by the FDA, which is a huge step. Unfortunately, in Tennessee, and this is something that we're dealing with here, Tennessee has not given the okay to go on. Florida, Texas, they're rampant and they're going. But so a couple other very common peptides that are on that list. There's about 25 different peptides that are out there, and if you're interested, a really good one of my mentors is Dr. Jim Lavallee. You can find him on Instagram. He's really great. He's been in the peptide space for about 25 to 30 years. I can't remember the exact time, but he has a lot of information of various different peptides. But in kind of circling back to your question, a really popular one would probably be CJC epimorelin. What that does is it mimics growth hormone.
Okay.
And so, in talking about, with adrenal insufficiency, there is a lot of talk of like hormone or different pathway replacement, whether that's hydrocortisone, and sometimes if it's hypopituitarism, growth hormone. This actually isn't giving growth hormone itself, but it mimics it. So it mimics the body's diurnal response of sleeping and then regenerate. So it really helps with restful sleep and helps with metabolism as well as muscle building. And so it kind of helps set that kind of diurnal go to sleep, because when we're children, we're a child, we have that growth kind of happen at night at about 1 a.m. And so it really helps with that sleep. It's something you take at night, and then it helps to have that kind of reset to tell the body, okay, we're producing this. Helps with weight loss. I have seen more weight loss a little bit more in men than women just in practice, but I've seen it in both. Help with energy levels, help with muscle composition, decrease adipose tissue. So, and really, again, generally safe in everyone, even cancer. And this, people to caution would be anyone who is already on substitute growth hormone, because those levels are being monitored kind of specifically by your doctor. And if you're in range on that, you probably wouldn't want to mess, without speaking to them, whoever's treating you for that, on where you are with things. Okay. But that's a really popular one that we've seen too that could be really helpful. There's one that's coming, and I know a big problem too is like sleep and rest cycles. Yes. And especially I've kind of read that in the group as well.
Oh yeah. I think we all suffer from lack of sleep or oversleep. Right. So like I go through the constant cycle of I need to be in bed 10 to 12 hours, and that might produce maybe 4 or 5 hours of sleep, because it's like this awake, asleep for me. Yeah. Some people have insomnia so bad they can't sleep, and then other people just are so exhausted that they can't get out of bed.
Right. And so, the CJC epimorelin is good because it binds longer, and so there is some evidence that it really helps with energy and that regulation of sleep and wake.
Okay.
There's another peptide called Delta something. It's not one that's coming out on this first wave, but it is actually supposed to be like superior and better at just naturally resetting the body between sleep and wake than like melatonin. Which, melatonin has its place, but
sure.
The Delta is going to be, I feel like when that comes out on the market, will be really life-changing for people. Yeah. And it is really interesting just kind of the history of peptides. All of these things were available up until the time that the GLP-1s came out. And call me a skeptic, but, in pharmaceuticals especially, I think sometimes we have to question things. And when there was an opportunity, I think, to make money, Eli Lilly and Novartis kind of, hey, let's these are not tested. Let's take these off the market. Ours are tested. And so actually the GLPs are considered a peptide that help with the insulin pathway. And so at that point, that is when kind of the shift happened. Yeah. So it's interesting.
Okay. Yeah, that is interesting for sure. So, thinking about, like, I know a lot of us in this community have sensitivities in, like, the nervous system, the autonomic nervous system, and the way that it fires. And sometimes we get these, like, crazy adrenaline spikes, and we get, you know, all this kind of craziness that happens in our body. Is there a peptide that kind of helps with that, or is that, like, I know we were working on that through the gut for me.
Yeah. Actually, BPC does that.
Okay.
BPC actually works, and this is something that I recently, like I said, I'm always learning, and I'm always, like, willing. I was like, ooh, question me, to ask me, you know, because then I'm like, that really makes sense. So it's actually being used in helping with alcohol withdrawal, due to how it helps kind of not like regulate, I guess best word, regulate the brain, and as well as, like, kind of helping with intoxication. And so it affects, like, your serotonin receptors and GABA receptors to just kind of, if you're here, bring you here. If you're here, bring you here, for more of a regulation to normal. The other thing sometimes is, you know, could you question, you know, NAD sometimes too.
Yeah.
The repair with NAD to kind of, I feel like NAD does the same thing a little bit too, you know. With that, you're working more of the DNA repair, and there's some critics of or I don't want to call them critics, but just questioning, hey, NAD, if you have cells that are fragmented and you're perpetuating that. But that does seem to help, you know, people who don't sleep to sleep, people who can't wake up to have more energy. It's one of those, like, cellular support things, and you know, usually low and slow. That's always what I say. Like, if someone's like, okay, we're just going to go max dose, you can't do that. And especially in people with, you know, adrenal insufficiency, because, you know, you got to take into account, and whoever is prescribing this for you or leading you on this journey should look at all your medications, should look, okay, this is how I feel, and talking about how you feel, because otherwise you can't get to the bottom of how things are happening. And, you know, labs can help us in kind of supporting, okay, what do we need to support here? Are we seeing, I don't know, are we seeing where, or even, you know, the labs that you've even had done by an endocrinologist, is bringing those is super helpful. Because, again, what are your tendencies? You adjust the dose and peptide accordingly. And so I think that's what makes this a little bit more challenging.
Yeah.
Because, you know, usually in medicine it's like, oh, hypertension, you know, losartan, or, you know, whatever, lisinopril. Like, that's not the case here. It's looking at the body, looking at the symptoms. And I always ask my clients, I say, hey, if there are 3 things that we can make better, what would that be? And, you know, and I always challenge people, what are your 3 things in regards to your health? Is it sleep? Is it energy? Is it weight loss? And then a lot of times, okay, we take what those 3 answers are and say, okay, so can we build the foundation to then do this? And then what are your concerns? Are your concerns, hey, you know, I don't sleep, and, you know, when I do sleep, then I sleep for 6 days. So, you know, regulation is important to me.
Yeah.
And so how do we gradually build you into regulation? And I think sometimes, again, in Western medicine, and don't get me wrong, I was trained by a Western medicine PA program, and I learned, you know, my learning has all been since my postgraduate studies and because of my interest in it. Going to courses in Texas, going to courses Nashville, kind of all over, trying to just kind of get any information that I can, because it's hard, because it's not one size fits all. And just like, again, all of you aren't one size fits all. And that's the important thing, is one, finding someone who listens and then kind of puts together the pieces for you. Because it's not something, okay, yep, my prescription, Amy said I need BBC this much, and this is it. You know, and that's even kind of with you, what we've said, hey, let's try this, let's pivot, you know, how's the dosing, are you feeling it, okay, and then maybe we come off a little bit, because BBC is in 30-day cycles typically, and then do we go again, or where are we in
Yeah,
my
and
journey.
I just finished my 30-day cycle yesterday.
Yeah.
So
yes.
So we'll talk about
So
that after
correct,
this
yes,
today.
yeah.
But I think the other interesting thing too that I've learned from Amy, and I know something that a lot of you have a question about too, and I'm putting her on the spot because I told her we were talking about peptides. But and Rick will probably shoot me for saying this, but Amy is also helping him with like his hormone panels, right? So he's on testosterone now, and watching his transformation has been incredible because my husband already was, as you all know, pretty incredible, I think. But he has become his, like, I don't know, mid 30-year-old self or, early 40s. All of a sudden, he has so much energy, like he's back to pacing the floor at home when he's talking or thinking. And like, he stopped doing that years ago, but now like the last few weeks, he's like literally pacing in the office, pacing in our living room, and he used to do that all the time. And our kids used to laugh because when they were young, they called it pasting. And so they're like, oh, he's pasting. So I always get a chuckle out of it when he does it, but he's back to doing that again because he has so much energy. And so one of the other things I want to talk to Amy about too today, if it's not putting you on the spot too much, is like, how do our hormone levels play into like how we feel with adrenal insufficiency, and how do we get started on that journey?
So I think for this, for this question, and this is something we've talked about a little bit.
Yeah.
I think unfortunately it's under tested, in adrenal insufficiency just in general. Well, one in people in general, but it becomes even more important in people with adrenal insufficiency because, again, we talk about metabolism, and your day-to-day function is a collection of everything that's going on. We already know in this particular pathway, in how your body responds to stress, how your body kind of, all of that feedback loop from the brain telling your adrenals, and that's impaired, and we know that. That's, it is what it is, and we support the body the best we can, we treat the body the best we can, but there's other pathways that also help compensate and do metabolic things that adrenal insufficiency patients have just like everybody else. And unfortunately, as we have more birthdays, typically that tends to decline. And in looking at some of the things, so now you have one pathway that's not kind of in haywire, and then here you have these other pathways that are in haywire here, and then it's just this chaotic mess, and no wonder
That's what it feels
people feel, and you're like, am I crazy? And then you get labs done. Oh no, you're fine.
Yeah, exactly.
And so,
exactly.
And and I've had the pleasure of knowing Kristen and Rick for quite a while now, and so they're a great. I always say like they're my model couple who I want to be like. But and in general, like when you see that part of that dysfunction, you become a little bit less like yourself, and then you go and you're like, oh, everything looks fine. We'll see you in 6 months. But
and you walk out the door scratching your head going, but I don't feel fine.
And, normal values are not optimized. Again, it comes with having that conversation. But, so a lot of, again, I try to, I'm very interested, so kind of tidbit about me. I have Hashimoto's. And so there is a lot of research that shows, the importance of trying to protect your adrenal axis and, trying to support that as much as possible because I'm at higher risk to have adrenal insufficiency. And so in looking at that, it's been really interesting to see the connection between cortisol and specifically testosterone. That is something that we see when people have decrease in testosterone. And so testosterone in a nutshell is mood, muscle, and sex. That's always what I tell people. That's dumbing it down, and it's not anything kind of crazy and not anything that should not be talked about. I think sometimes it gets a little bit of taboo, but if you break those down a little bit further, what that looks like, things that I see in most of my patients with low testosterone, brain fog, severe fatigue, difficulty with kind of remembering what was I talking about?
Oh my gosh, you're talking about me right now.
and mid-sentence, and feeling like, hey, things with my partner, my intimacy is different. I don't feel like hanging out with my friends after I deal with the day. I'm just done. And you may be thinking, and even, what, this kind of sounds like some of the things that we see with adrenal insufficiency. And so imagine if no one's looking at this or talking to this, you already again have this, and then you're here, how's your body supposed to recover from that? And there's also, and I shared this with Kristen, and it's just because it's here, because we're at the spa today, like, there's also so many, like, preventative things. So I'm just going to read you by the lab's normal readings, what kind of clinically by studies that we've seen. So testosterone of 600 has an increased rate of mortality. 450, type 2 diabetes. 432, severe fatigue, libido loss. 332, coronary artery disease. Even going kind of up to 770, metabolic syndrome, prostate cancer, and protection against Alzheimer's disease. So, and looking at things, and especially, again, supporting the body where it needs support. And that's looking at, you can be someone who has, adrenal axis, but you can also have these things. And I have seen that looking at labs on people. And sometimes, too, the body, I heard something the other day that says there are signs in lab work, but if no one's looking for it, and I heard it, and it made me think of you, because again, I've known Kristen a long time, and there were some things, and we were like, oh, that's what's going on there, and there were signs, but until you're sick, until you actually are sick, it doesn't all make sense. And so I think even part of that, and I always try to say that all my experiences, I hope that it makes me a better provider, because you want to be able to you can't just look at one thing. You have to look at the whole picture. And that comes with finding someone too that you can talk to and listen to and have that conversation. It's not taboo. Women have testosterone too. And the FDA currently says that a woman's allowed to have a testosterone of 0. And so if your scale is 0, you're never going to be off the charts on labs. But I think it's even more, and kind of circling back, it's even more important to look and ask those questions in people with adrenal insufficiency, because again, we already know that there's an axis of support, and then here you're leaving them hanging on all these other things.
Yeah, which really sucks. Yeah, agreed. And so that kind of leads me to another question. So like my body, when I was diagnosed, it wasn't making. Essentially, I was 0.38 for my DHEAS. And so I did get on DHEA supplements, and it took about a month for it to start, reacting a little bit. But I also know that I need to have my testosterone checked, right? And so I'm going to go through all this with Amy again, because I want to get on this path. Because I know that there's some other things that I can do to probably support myself. And I think this may be part of the key. This is just me thinking out loud of why some of us don't do as well as others that have adrenal insufficiency. Some people can work and carry on life as if it's, relatively normal, while the rest of the population with adrenal insufficiency is suffering greatly. And I think it's probably because it's not just adrenal insufficiency, but we probably have other hormone issues and other things that need supported in our body in order to be able to function at the levels so that we can get back to kind of who we were, right?
Right. Oh, and then there just becomes a whole nother element to it, because when this happens and you feel so terribly, and let's talk about the mental health part of them too. Yeah. You're like, I am this shell of who I used to be. You mourn who you used to be, how you used to feel. Then again, it doesn't go addressed, and then there becomes SSRIs or SNRIs, which are great medication. I'm not knocking those whatsoever, but they also pull from your hormones. And so if you don't have any to begin with, there's currently looking at studies that look at SSRIs and then looking kind of retrospectively at hormone levels. And sometimes the whole issue was hormones to begin with.
Oh, wow.
Okay. And so, and then you pull these in, and it's just, and again, there's not a right or, but, and it's not a simple kind of, and now they're, especially who we work with, they're looking at, hey, can we normalize natural serotonin in response to this? Because, and it's just crazy. So then you're even depleting it even more. And so it's just, so on a tank that's already empty, you're running on fumes, and we're pulling the fumes. And I don't know.
So I guess that leads me to a bigger question because, first of all, we're worldwide, and so this conversation is going to look different for everybody with their providers, right?
Correct.
And I know for a lot of us, and I know you've heard this struggle in our community so much, a lot of us have a lot of difficulty with our endocrinologists wanting to look beyond the labs that they pull or beyond the adrenal insufficiency to look at hormone levels. And so then you've got your endocrinologist who's looking there, you're hoping your PCP will pull this over here, etc. Any advice for us on like how do people get started on this hormone journey? Do they go seek out somebody like you? What is the best way to find the right
right, and it's hard.
The right support.
It's hard. So you need to find someone you can talk to and feel heard. That would be number one and number two. And it may look different because with every population and who that person is. Is it your endocrinologist? Is it more of a functional medicine? Is it your primary care? So who can take the time? Because I will tell you, and again, I've worked in both spaces. They don't have time to get into everything that you need in 15 minutes. And that is a failure of the healthcare system. And I wish I was smart enough to be able to fix that. That'd be amazing. If I had that mental capacity, I wouldn't be working 7 days a week trying to help people. But I do think it's finding that person that you feel like you can share and feel heard. And they may not always have the right answer immediately, but someone who wants to ask the question of why. And you say, well, why is this? And, and I say this all the time with my patients, that's a really good question. And I'll say, this is what, the pathophys, that really makes sense to me. But that is a really good question. Let's look into this more. Let's look into that. Tell me what you're feeling. Tell me your three. Let me see what matches. Let me look at all the medications you're on. Let's take it back to the beginning. And I think right now, as medicine stands, that is more of something that's not in your typical healthcare realm. Again, because a lot of that kind of starts at the beginning and tries to get to more so root cause, or how do we get you feeling better, and someone who's willing to look, and this is my belief, again, take it for what you will, someone who's willing to look at all avenues. Because if you felt, and I even tell my dad this, if you felt bad for the last 20 years having this problem and keep doing the same thing, what do we call that? Insanity, right? Yeah. And so someone you feel comfortable with, and that's going to look for, so here at my practice, it's myself and a nurse practitioner, and even our minds are collectively trying to bounce off, okay, what could we do differently? Someone who's open to that, because, I feel like, especially with adrenal insufficiency, no two people are exactly the same. And so your history, your medications, your individual story should be important to that provider. And this is where it gets tricky, because I feel like, unfortunately, nowadays, and how the system is set up, that looks more like more functional medicine, less insurance covered, to be honest, more of that, what do they call it?
Like concierge medicine?
Yes, concierge medicine.
Yeah.
Because we can take the time, and we don't charge arm and a leg. Consult usually charges $75, and that includes us getting your labs, getting all of the start to finish side of things.
Yeah, which I would say, if you can find somebody like Amy, because like you can run my labs through my insurance,
right,
and all of that, which is fantastic. I'm fortunate because I have Amy, and because I also have a primary care physician who is, I will be so sad the day he retires, because
he's not allowed.
Yeah, I know, because he listens to me, and he really does investigate and research, and it might take him a little while, but like he'll read the papers that I bring him and the research that I bring him and answer my questions. And he really is caring, and he truly cares about the patient. And I know that's difficult to find, but if you haven't found it yet, please keep looking.
Right.
I know Jenny created a post just a couple days ago talking about concierge medicine. She may be somebody to hit up in our Facebook group. If you have questions about concierge medicine, she was saying she really enjoys the experience. It's, you get faster appointments. She gets more in-depth information. For me, it's something I'm willing to pay for to do things like that because my health is so important to me, and I know that it's not any less important to any of you, and I know that not everybody can afford to do that, and I appreciate that too. But keep looking because there's somebody out there for you. Don't give up hope. Find somebody like Amy. Find a good PCP. Find a good functional medicine doctor. Somebody that can help you get on this journey. And Amy, out of respect for your time, I don't want to keep you all day. I know she has a practice to run here, and so I just want to thank you for having this chat with us. I'm sure there's going to be questions that'll pop up, and I'd love to do this again if you're open.
Of course.
Okay, awesome. Well, I appreciate it. Thanks, everyone. Again, Kristen with Amy from My Adrenal Life today, and I hope you all have a fabulous weekend, and we'll talk again soon.